I don't move as well as I should, so it's helping me to get going. Building up my muscles, and it's very enjoyable.
I can't stand very well, but I've got more push.
Here in Derbyshire, it became apparent to us that there is an area of older people who were not getting the same services as others. So to address this, we looked at trying to do some preventative work within the care homes.
The residents have been made to feel special. They've been given one-to-one support as well as having team sessions. A lot of the residents have felt more confidence.
We're like two parts of a jigsaw. The care home staff are caring for them, and then we're coming along encouraging them to remain independent.
Looking back and seeing the difficulties that we had before and the life-changing differences that we've seen and the support that we've got, I couldn't imagine now how we would manage without that help and support.
Well, the problem was a classic one, a small hospital, but in a rural area.
And there was a very real threat that we would actually lose our hospital, which, if you look at the geography of our area, it would make us an acute healthcare wilderness.
The GPs came to us saying, we think we've got a vision, but we need your help because it's quite radical.
And we developed a clinical model using GPs as the actual doctors, but still with consultant physician and consultant A&E supervision and access to their services.
The great success story is not only have we transferred the services safely to the new model of care, but we've also increased the number of people being treated at Louth.
But they're going home more quickly because with that integration of care, we can actually plan their discharge and get them back into the community a lot more quickly.
We're now using it elsewhere across Lincolnshire, and I think we've proved that GP commissioning can work.
Well, Nottingham in particular has got a big alcohol problem. The hospital alcohol-related admissions is increasing dramatically. Last Orders is aiming to get people before they get to that dependent stage, so it's trying to help change the behaviour. We have three main areas that we look after. One is health promotion side, so going out to fresh affairs, the community centres for ethnic groups, and also gay pride, so areas like that. Secondly, we do the one-to-one support. We based it in primary care so that people can access services easier and there's less stigma about going to your GP surgery. And thirdly, we've got a training. And we've trained over 2,500 GPs, primary care staff and midwives, for example. Most of the staff at Last Orders are trained nurses, and I think that gives us, from a GP's perspective and a service user perspective, that we're professional and accessible, and we've got a code of conduct to work to.